Hello friends, my name is Ankit. I make educational videos on US healthcare. I'm back with another video on dental data exchange using FHIR implementation guides. If you're new to my channel, welcome. If you continuously watch my videos, I would like to thank you. Please like and subscribe to my channel for future updates. Now coming back to this video, let's talk about dental data exchange. Currently, there is no standard for the exchange of discrete dental observations between dental providers. While some dental electronic health record systems have implemented CCDA for data exchange, that standard was primarily built for medical care and does not include most structured data elements needed by dental providers. The Department of Defense (DoD) and the American Dental Association, also known as ADA, recognize the need for foundational dental data exchange between medical and dental practices and among dental practices. The DoD wishes to support the dental health of the service members and their readiness for deployment. The ADA wishes to support a continued industry-wide drive to promote and enhance standardized and structured dental data for seamless interoperability using CDA and FHIR. Representatives from the DoD, ADA, and the industry leaders convened the Dental Data Exchange project in late summer of 2019. The first project milestone was identifying key data concepts that could successfully transmit a dental referral between two dental systems or between a medical and a dental system. The project focused on adding structure to unstructured dental data elements while maintaining alignment with FHIR US Core Implementation Guide HL7 CDA R2IG, CCDA template for clinical note, released to US RAM and HL7 CDA implementation guides. Independently, the CareQuest Institute for Oral Health identified a need for communication and coordination of care between oral health providers and other healthcare disciplines. The inability of health information system to meaningfully share data limits the healthcare system's ability to address whole person care across the lifespan and therefore is detrimental to healthcare outcomes. The electronic communication of clinically relevant medical or dental information when referring a patient to a dental provider and the ability to close the referral loop via a dental consultation note to the referring healthcare provider is vital to improving care coordination and the provider collaboration. The CareQuest Institute for Oral Health joined this project in fall of 2019, bringing their requirement to the development of standard dental referral and dental consultation notes. This project defines FHIR artifacts to extend the CCDA on FHIR referral note and consultation note to include dental specific data concepts called in for in ANS ADA 1084 standard and the CareQuest Institute's More Care and Oral Health Value-Based Care Initiative. The project references value sets set by the systematized nomenclature of dentistry, SNOD ENT working group under SNOMED CT. SNOD ENT is an official subset of SNOMED CT that provides standardized terms for describing dental diseases, captures clinical detail and patient characteristics, supports analysis of patient care, services and outcome, and the interoperability with electronic health record and electronic dental records exchange system. The current approach is defined under this project, which uses the ADA 1084 as the authoritative reference for dental data inclusion because the ADA created it through consensus across dental providers about what shared dental concepts could be exchanged. The work group compared the ADA 1084 to the FHIR R4 standard, identifying gaps in FHIR representation of dental data concepts. The project prioritized ADA 1084 dental data elements within the data domain categories and grouped the data domain by dental referral node, referral sent to another system requesting dental services, and dental consult node, which includes referral outcome sent back to the requester. Now let's talk about various use cases where we need to utilize these dental FHIR-based interoperability standards. The first use case is medical to dental consult note. Patient A is a 30-year-old male who has mild hypertension, type 1 diabetes, and has an insulin pump. He sees his primary care physician, Dr. John M., at a Good Health clinic for a routine annual checkup. Aside from medical concerns, patient A mentions increasing pain in his left lower jaw and some occasional bleeding from his gums. Dr. John M. makes an urgent referral to a dentist for further evaluation and discusses the plan with patient A, who agrees with the plan. Dr. John M. generates a patient referral note that includes data describing the dental related findings. Before patient A leaves, the referral coordinator at the front desk schedules an appointment for him to see Dr. Drew dentist for the next day. Now, if we look at the workflow, Dr. John M. determines patient A needs a referral because of the specialized care needed. The dental referral note sent to Dr. Drew's assistant. Dr. Dentist performs evaluation on the patient A the following day and summarizes the dental consultation note. Dental consultation notes are sent back to Dr. John M. with a new prescription, planned procedure, future appointment dates, and the patient goals. Dr. John M. reviews the dental consultation note during follow-up visit with patient A. Now, let's talk about the dental to medical consult note. Patient A sees Dr. Drew, dentist, on February 16th for an urgent evaluation based on a referral from Dr. John M., his primary care provider. Patient A is now a new patient of Dr. Dentist's office, so a new patient record is created. Dr. Dentist reviews the risk assessment, the dental referral note from Dr. John M., and the rest of the information that was pre-populated in the dental EHR. Dr. Dentist performs an oral evaluation and the two PA radiographs. He identifies two areas of concern. Patient has a significant non-restorable caries lesion, decay, on the left lower back molar, tooth number 18, with signs of infection and early signs of decay on the right upper incisor, tooth number 7. Dr. Dentist recommends an extraction of the left lower molar, tooth number 18, and restoration of the right upper lateral incisor, tooth number 7, due to a caries lesion, decay. Dr. Dentist explains the importance of using a fluoride toothpaste when brushing twice daily with daily flossing and the need for biannual dental visit for examination and cleaning. Before patient A leaves, the receptionist schedules an appointment for the extraction of tooth number 18 on February 23rd, another appointment for restoration of tooth number 7 on March 3rd, and a follow-up appointment for a complete examination including radiographs and prophylaxis on March 10th. Dr. Dentist reviews patient A's current medication list, notes an allergy to penicillin that is a counter-indication for his typical recommendation of amoxicillin, prescribes erythromycin 500 mg every 6 hours for the infection, and recommends alternating over-the-counter ibuprofen and acetaminophen for pain. As he generates a dental consultation note back to Dr. John M. with a summary of patient A's visit, including the new prescription, planned procedure, future appointment dates, and patient-specific dental goals. That's where the use case ends. Now let's talk about the final use case, which is dental to dental endodontist consult note. Patient A contacts Dr. Drew dentist complaining about pain in lower right quadrant of his mouth. He mentioned the pain started 2 weeks ago and worsened. He noticed sharp, stabbing pain provoked by drinking cold beverages in the past week and lingering pain with biting in the last 2 days. Patient A is able to eat regular food but is only chewing on the left side. He is taking 400 mg ibuprofen every 8 hours for the pain. Patient A has a history of hypertension and takes lisinopril 10 mg tablet once a day. He is also taking erythromycin 500 mg every 6 hours for the infection and additional ibuprofen for pain as needed. He is allergic to penicillin. Dr. Dentist takes patient A's clinical impression and sends referral to endodontist for an evaluation of tooth number 30 and endodontic therapy number 30. Referral included medications prescribed, diagnosis, prognosis, treatment notes, images, and follow-up recommendations. Patient A was experiencing pain that started 2 weeks ago and has progressively worsened. He noticed sharp stabbing pain provoked by drinking cold beverages in the past week and lingering pain with biting in the last 2 days. He is able to eat regular food but only chews on the left side. He takes 400 mg ibuprofen every 8 hours for pain, and his last dose was a 2 hour prior to his visit. He visited his general dentist and was referred to endodontist. Previous medical and dental history verified by the endodontist. 1 month ago, patient reports he had a MOBD amalgam restoration placed in his right lower first molar, tooth number 30, for a fractured tooth. MB cusp lost due to undermining by caries lesion. Previous medical history and allergies from referring dentist. Medical history. Patient A has a history of hypertension and is taking lisinopril 10 mg tablet every day. Patient is also on erythromycin 500 mg 6 hours each day for the infection and taking ibuprofen and acetaminophen as needed for pain. Patient is allergic to penicillin. Endodontist also verifies intraoral and paraoral findings from referring dentist. At the end of the visit, a dental consult note is generated including medications prescribed, diagnosis, prognosis, treatment notes, images, and follow-up recommendation and sent to the endodontist to the general dentist. That's where the use case ends. Now, more than ever, it is important for us to understand that if we need to exchange data, the data needs to be a standard FHIR interoperable format. This is a genuine attempt by some of the industry's experts to define standards. Thumbs up to all these stakeholders for working hard to improve the health outcome for all the members. That's it for today's video. Look forward to hearing your feedback. See you all until next time. Have a good day.